project called Fire Server, very creative, Fire Server for Azure, to assist developers in exchanging and managing healthcare data stored on the company's cloud. The NIH is partnering with technology company NVIDIA to create artificial intelligence tools to support clinical trials. So the big hitters in data are circling the space. Yet in healthcare, we really have fits and starts on the data front. What are some of the things what are some of the reasons you think we've had, we've had some successes, but we've really, I don't know, we can't get out of our own way in some cases. So why do you think we haven't been as successful with data as maybe we could be?
Well, for one thing, lately, the last 10 years or so since Meaningful Use came along, we've been so consumed with meeting the compulsory measures. Right. Who's got time to do anything creative with data, really? I mean, right? It's an ocean of compulsory measures that is also undermining clinician satisfaction and contributing to their burnout. So it's a classic case of distraction, for one thing. We just don't have time. If you go back to the early days, when I started my career at Intermountain, the compulsory measures at that time, for the most part, were limited to Joint Commission, and they were a pretty small number. And so what it gave us as an analytics team and a culture was the time to do cool things with data, which put Intermountain on the map. And literally, there's no bandwidth left. So I'm really actually encouraged, in spite of all the craziness of the Trump administration, Seema Verma and others, I'm starting to see some common sense return to those compulsory measures. But we need to slash and burn compulsory measures and give the industry some time to perform analytic ingenuity and creativity on their own.
Yeah, we need a chance to breathe. I had a similar, when I became the CIO for a health system, our internal auditor kept doing security audits on our team. And when I went to our team, I'm like, all right, we need to get ahead of this. They just looked at me and said, we can't.
Yeah.
There's too much here. So I had to go to our internal auditor and say, hey, I need a reprieve. You need to give me a reprieve for 6 months. Like no audits for the next 6 months. A year would be better. So our team can actually put some things in place, and then you can come back and do as many audits as you want, but we just need some time to really get our house in order. And that's essentially what we're getting from the federal government, of just continually changing. But I agree with you. I'm seeing some positive things there.